The next manipulation is for the cuboid. The cuboid is located on the lateral side of the foot between the calcaneus and the fifth metatarsal, so that puts it right where my finger is here. And on the bottom, it's more to the inside than you would think. So it's not on the outside, it's right under here. And it can be palpated, usually with the thumb, to find out exactly the location. And when the cuboid is restricted, this site can actually be somewhat painful to manage. And the manipulation is as follows. First, the exam to see whether it's stuck or not. The rear foot is held stably with one hand, and the lateral column is grabbed with the other. And then while the rear foot is stable, a dorsiflexion motion is applied to the foot, and you should see motion across this axis of the foot to see how it would work. And so this is dorsiflexion that should occur, and that's very restricted. We take Terry's other foot, hold it the same way, and move it. The range of motion is normal on this side and quite easily visible. Once you've determined that the lack of range of motion exists, then the manipulation takes place. Your thumb is bent at the IP joint, and it's going to work like a small little piston. You press up under the cuboid, and sometimes this can actually be quite painful. And it's very important to find that pain spot, because there's a way to relax this and makes it much easier. Once you find the painful spot, very gently invert the foot, slowly and carefully, and you'll feel the plantar surface of the cuboid actually release. And patients will tell you that it just doesn't hurt as much when that's done. They could feel the sensation. So once you feel that release from inverting it, then you take their toes and very gently and slowly plantarflex them, and you'll feel it release again. Once you've done that, you've made this manipulation very easy and pretty much painless. If you don't do this first, these can be very painful, and patients will complain about that afterwards. So try and release this first. Then once it's positioned, you take your hand, you put it over your thumb, and then you're just going to push up. It's just one thrust into the foot, relax, and the range of motion returns to normal. And you could really see the difference from before. And now it's quite comparable to the other. But I certainly was pressing here. You could see the red mark that was caused by that. But the change makes for a huge difference.